Yeah, the basic education minister there, Prof, appealing to the trade unions to speak to their members, make it very clear, like Mr. Strydom was saying in Orania, they won't force anybody, they are empowering people. But the minister sort of caught there because, we know the science, but she mentioned religion as well. From your perspective, Prof, I mean, do you think science will win this round of skepticism around the COVID-19 vaccines?
Yeah, Dan, greetings to you and the viewers. I actually don't necessarily think that the science is the problem. I actually believe that the fact that people can have conversations about this is supposed to be a good thing. I don't remember a time when information that is so scientific has become available to people. And in a way, I think the only challenge is that most of the time when the information is communicated, it tends to be communicated to highlight the problems rather than also kind of present a more balanced perspective. And it also happens in a landscape where, there's a lot of people who are peddling a lot of misinformation and disinformation, and therefore they take advantage of some of the challenges, be it issues of efficacy or issues of safety or side effects. They use those things to basically create a narrative that becomes quite negative and harmful. Other than that, I don't think it's a negative thing that we can have these conversations in public. In fact, we should be having more of these conversations, in my view.
Yeah, and I want to follow up on that, but I just want to bring in Robert Marawa, a colleague, sports journalist, a well-known friend in the media. Recently, he was in ICU. Robert, good afternoon. Welcome to the Midday View. It's good to see you. I'm pleased that you are still with us. And some weeks ago, you were in ICU. I wonder, what was your position before you caught COVID-19 and you had to be hospitalized? Were you a bit skeptical? I mean, being a sports journalist, being a journalist, skepticism sometimes runs in our blood, as they say, as journalists.
Thank you so much for the opportunity, Bradan. I think I'll always open myself up to trying to help by using my own experiences when it comes to medical challenges. Skepticism, yes, 100%. I mean, I was scared when my mom got admitted to hospital a couple of weeks ago, so how much more myself. But one thing that I can tell the viewers, when it comes to COVID-19, when anybody starts to feel anything strange or weird going on in their bodies, people mustn't start to follow funny things that they've seen or heard, advice from people that we don't even know, from YouTube and so on. The first thing you've got to do, then on that Saturday, when I went to sleep, I felt hot and cold flushes in my body. And I knew right there and there that there was a foreign body that had entered within me. So I don't hesitate. The very next day, on that Sunday, I took my son, I took myself, and we went to get tested. Both of us, because obviously we had been spending time together. And so it turned out, and I was grateful, because he had to go back to school, is that he tested negative, and then I had to prioritize his result. And then mine came way later. It did come out to be positive. And one tries all the basic things that we've heard. But one thing that my doctor, Dr. Chancellor, all the way in the UK advised me to do was to purchase an oximeter. So with that oximeter, I was able to track and see what my oxygen levels were, within my bloodstream and so on. And that was the major help, because when I woke up feeling extremely exhausted and extremely tired, I mean, I felt like I'd been running the comrades, and yet I'd done nothing but just wake up, take a shower. But I was extremely exhausted. And he asked me to check what my oxygen reading was. And it was on 92. And he said, listen, I know 92, a lot of people say you're okay, but I want us to get you hospitalized immediately. And that for me was the trigger. So you can imagine people allow themselves to go into the 80s when it comes to their oxygen levels. And that is already a danger zone. The intervention is already too late. So we need to try to get people to test early so that there is an early intervention. And that is why you find people scrambling around now, rushing, because it is very late and they have to be ventilated. I was on oxygen. Yes, I was in ICU for 8 days, but the intervention was very timely to allow me to still be here.
So don't ignore those first symptoms. Would you apply the same advice with that experience of having been positive, Robert, while I have you, to get the vaccine? If it's your turn to be vaccinated, would you encourage people to get vaccinated? From your experience, I know you're not a medical professional, but from your experience.
Yeah, I mean, I've learned a lot in this experience just from the team of doctors, Dan, that I had. I watched nothing, I read nothing. I was just learning firsthand verbally from what they were telling me, because remember, this virus, it's a third strain now. So what we were experiencing last year at this time is different. You know, the strains are different, which come with different characteristics of what we can expect. So when it comes to vaccination, I welcome that. You know, but are there enough vaccines? I doubt that. You know, so you can hear one thing that politicians are saying, but what is the reality? We're a 60 million population. They've had to destroy millions that were contaminated in the United States of America. So where does that leave us? It's one thing to hear politicians. It's another thing to see what is practical. So I would always prioritize frontline workers. I'd prioritize the elderly. I'd prioritize, yes, the teachers, everybody that gives a public service to jump the queue. I'm in my 40s, you know, my immune system, yes, it gets vulnerable. Yes, the virus did attack, and it was brutal. You know, it's a brutal, brutal fight, but it's also a mental fight that you've got to go through. Vaccination is something, yes, that we all need.
Okay.
But we've been very lax in terms of putting it out.
You're making a very valid point. Don't go anywhere, gentlemen. Prof, I will come to you now. But, Mr. Strydom, the numbers, I mean, currently in Gauteng, the coronavirus numbers are skyrocketing. And we're told by scientists that Gauteng is like 2 weeks away from spiking, maybe early July. I mean, it's unbelievable. It's so scary, so to speak, here in Gauteng currently. The Premier, from a political perspective, using the words the other day, that currently, in terms of the virus, Gauteng is a dangerous place. In Orania, I understand the numbers are low in terms of infections. How have you managed that?
I think there's a lot of aspects to it. Some of that is proactive. Some of that can be credited to the way that it was that the medical teams in Orania prepared for the virus. The fact that we proactively took action and upgraded our medical facilities, we can credit some of that to the decisions that the emergency operational team has made and implemented. But I think there's also a large amount of that being accredited to just the fact that it isn't such a big community, that we are in a rural area. There's not as many people as, for example, in Gauteng. It's not so densely populated. Orania is not as populated, obviously. And although that obviously helps us, on the other hand, in a smaller community, people have a lot more personal contact with each other. However, I think the way that our medical staff in Orania are treating potentially sick people, people who have tested positive, and advising the general population is good and effective. And also the fact that here in the Northern Cape we have a lot of sunshine, and I think, you know, the virus obviously can't survive all that long in open sunlight. That's good. We are people that work and live a lot to be outside, we're not inside all the time. So I think that's positive in terms of that. But in the end, it's the medical professionals that's been doing a fantastic job tirelessly. And also as religious people, we believe that it's grace from God, obviously, that we are not free from the virus. There have been some cases, but this far it hasn't gone all that bad.
Yeah, okay. Thanks, Mr. Strydom. Now, Prof, just to bring you in from a scientific perspective, I mean, what do you say to somebody still today who might say, you know, COVID-19, it's not going to really affect me, you know, I'm okay. I know a couple of people in my own social circles who are even much older than me who say, I'm not going to get the jab. And I say, but why? And people say, no, I don't need something at this age in my body. This thing, I mean, really, if it's time, it's time.
Yeah, it's a very good question. I think in general, when we draw from sort of the behavioral sciences, we understand that there will always be, in any population, there will always be about 10 to 20% of people who sort of lean towards high-risk behaviors. And those high-risk behaviors also involve people having to intentionally subject them to this kind of denialism and so forth. And we also understand that, some of these things are tied to people's beliefs. When we think of healthcare, we don't just think of it medically. We also think of it in terms of psychologically, mentally, emotionally. That is the whole well-being of a person. And so a person may understand scientifically what the virus is, but if they have a religious belief or a traditional belief that tells them something, that is part of their well-being. So in assessing the extent to which people are going to accept interventions or reject interventions, then we have to take into account their holistic beings. That's why for us it's important to not only communicate the science, but also the behavioral part.
Yeah, I want to pick it up from there. So I'm hoping Mr. Strydom can hear you, because this whole issue of the vaccine hesitancy, so many grounds. People have so many grounds being skeptical. But he made the one point earlier, Mr. Strydom, that people are saying, but it's taken so quickly. These scientists have developed, these companies have developed this vaccine in such a short space of time. I can't trust it. How do you respond to that, Prof? How would you respond to that from a scientific perspective?
So my response to that is that, do you trust your cell phone? Do you trust your computer today? These things many years ago, they were very big. They didn't have the kind of technology that they have right now. You have a kind of cell phone that basically it's so many things in one, computer and many other things in one. And so if we can accept that in other respects technology advances, then why can we not accept that medical technology, biotechnology will also advance? And if we can accept that biotechnology will advance as well, then we can understand that in the future, we don't want to spend 5 years or 10 years developing vaccines. We have been able to get to a point where we can improve those systems. And so going forward, we also want to make sure that that continues. That should not be the grounds. What a person needs to do is to be able to focus on the procedures that were followed, the science that is being produced. If you can assess that, then that's okay. Don't just use time only.
Yeah, just assess the whole thing holistically. Mr. Strydom, I'm going to let you go shortly, and I'm going to continue my conversation with the professor and Robert Marawa, because I'm going to be bringing in Reverend Kenneth Mishwe later on. That's what I'm hoping to do. I spent quite some time in the beginning, Mr. Strydom, talking to you about the setup in Orania. But I want to give you a parting shot very quickly. I mean, when it comes to addressing vaccine hesitance, with your experience in the conservative Afrikaner community of Orania, with your low numbers, what message would you give now, hearing Robert's story, hearing the professor's remarks to the rest of South Africa? What would you say to them?
No, sadly, I couldn't hear the professor's side. The system didn't allow me to also listen to his side. I would have liked to hear what he had to say. But shortly, I would say people should treat their health seriously. They should, if they experience symptoms, they should treat it the right way. I think the Orania way is to say treat it proactively. Make sure to get to your doctor. Make sure to understand the options that's available to you. But also, I think giving the broader picture in South Africa, forcing people to do things that they don't want to do is not going to be a good way to treat people that won't take that's not willing to take the vaccine. Information, spreading the right information is good. That helps with uncertainties. But we shouldn't push people who don't want to take the vaccine to do it. And I think informed people make informed choices. So if people can get their hands on information that's relevant to the coronavirus disease, also to the different types of vaccinations that is available, that is good. And people should be left to make their own individual choices, as is the way in Orania. For the rest, stay healthy, stay safe, and at the very first sign of symptoms, seek professional medical help. And that has been working for us very well.
Thank you very much, Joost Strydom, the head of the Orania Movement, sharing with us some insights here as we discuss this hour of the Midday View on this Friday afternoon, the ongoing hesitancy to get the vaccine, and just sharing some of the insights and experiences around the numbers as well.